Welcome to the Wonders of Women's Health, what every female should know. And my guest today is Antoinette Erskine, and we're going to talk about what women need to know about the menstrual cycle from puberty all the way to adulthood. Why do we need it? How do we talk to young girls about it? How to care for the body so that we can avoid some of those preventable diseases that women experience throughout life. And so you have sent in your questions, and we're so excited that we want to answer those questions for each of you. And in the event you have additional questions, we will absolutely love to hear them. Remember, this is for educational purposes only. So even though I'm Dr. Sankey, I am not a medical doctor. I do not assess, I do not diagnose, I do not treat. And so the information that we provide for you today is for educational purposes only. If you have specific questions, it is important that you contact your physician, ask those questions, and explore exactly what your options are to live your healthiest life. I want to say thank you for joining us today. And I want to just say thank you, Antoinette, for joining us today to talk about the wonders of women's health, what every female should know.
Yes, thank you for having me. It's always a pleasure joining you. I really appreciate you extending this space because, women, we need this. We definitely need this. So thank you for having me.
Oh, you are welcome. You know, the menstrual cycle is something that people don't really like to talk about, even as women, even though it
Yeah,
to us, and even our mothers and grandmothers have gone through it all, for years and years and years. This is a difficult conversation that people, they have difficulty having this
they
conversation.
do.
And
Yeah,
even in puberty, it's a difficult conversation for parents to have with their daughters, and even
yeah.
for women to have with women, especially when they're encountering challenges. And so I'm
Mhm.
really excited today to just kind of let's start that discussion and jump it off and really start talking about at what age really should this discussion happen regarding the menstrual cycle.
Right. Um, I wouldn't say there's a specific age. I would say there's two ways to approach it.
Okay.
Um, the moment your little girl possibly sees a sanitary napkin and asks questions, or if she's in the store, or if she catches you in the bathroom, you know, that's a time you can start having a conversation, just saying, this is something that happens to mommy every month. And I have to use this to make sure I protect myself so I don't mess up my clothes. And, you don't have to get into details because, quite frankly, they're really not going to understand. Right. And then on the opposite side, if you don't happen to run into a situation like that, it could be when you start to see the pubic hairs starting to emerge, or the little boobs are starting to, to blossom. And so that's when it's the prime time to really have conversation, because at that point you can bet that her cycle is probably coming within the next maybe 6 months to 2 years. And 2 years is really pushing it. But I would say within that 6 month, 1 year period, it's coming. So you want to prepare her. It's not, I think one of the reasons why people are ashamed by it, one is we always associate, I think you and I had this conversation the last time we met, the vagina with just sex.
Yes.
That's just a piece of it, but it's very uncomfortable. On top of the fact that more than likely our mothers didn't have that conversation with us either, so you don't know what to say. We've always been shamed for it when there's absolutely nothing to be shamed of. But yeah, I would say, uh if she's not asking questions just out of curiosity, I would say the average would probably be 9 or 10 to start having that conversation.
Okay. So, that's actually a good age group because sometimes we think that young ladies or girls do not understand, but I think we can speak to them in a language that they can understand because maybe some of their friends, their cousins, or, someone has already started their period and have kind
Mhm.
of maybe, they may be aware of that. And so
Yeah,
19, I believe, is a good age that honestly they understand, they can comprehend that. So we
they
want to get
can.
sure so what are some of the do's and don'ts? Let's say, what do you tell them about how to inform you that maybe their cycle started, or maybe some don'ts, to do during their cycle? Anything that you would share regarding.
Yeah, actually, my mom actually started me with a book. We sat down, and that was like the thing that we did in the evening, like either at the table with dinner or after dinner, sitting on the couch and just having that conversation, reading through the book. But I think it's a lot easier now than it was back then because you have videos on YouTube. There's documentaries, obviously the books. So a lot of times, some of the questions that you may not know how to approach, they're answered in those formats, and it's something you guys can discuss together. So I wouldn't be too afraid of actually having the conversation, because you have other forms to kind of help you out in that sense. So definitely, I would say that's a do. Look into books, look into videos on YouTube, look into documentaries and things like that. The don'ts is, don't project your experience onto her, right? You can share and tell her, and probably that's why the documentaries and the books might be more helpful. But a lot of times you scare us, scare them, because now they're expecting it to be this traumatic, horrible experience, which for a lot of women it can be, and it is. So understandably so, that's how you want to approach it. But we're trying to shift the narrative, right? We're trying to have healthy conversations, a healthy approach to it, better understanding of what's going on. So you don't want to do that with fear, with shame, with guilt, with whatever emotion that you might personally have attached to it. Um, and I'd also say to let them, uh, instead of you worried about what to say, let them ask more questions, right? Like the more they're engaged, I think it's easier, as opposed to just throwing information. Like think about that classroom where it's more interactive and they're actually asking you and telling you what's interesting to them, what they want to know. It makes the flow of the class, if you will, it just flows better. And so I would just say allow them to be as open as possible with the questions that they have. And if you don't know the answer, tell them, you know what, I really don't know. Let me go find out, outside of, once again, projecting your personal experiences, because her experience could be completely different. Um, Another don't, well, that, I don't know if this is necessarily a don't in the beginning, because I think so much precedes this, but actually, I'm not going to say that. I'm not going to say it because I think I'll be able to introduce it from another angle with another question. So I
Okay.
won't say this yet. But yeah, those are my do's and don'ts for sure in the beginning.
So, I like the idea of getting a book or using resources online. I think because many times we're limited in our knowledge of the human body,
Yeah,
organs, how they function, and sometimes we're not able to give that enough information, background information about that we could be confusing or giving more information than they really want to know anyway.
right.
I
That's
do
true.
think it has to be clear that the woman's body and even the man's body, the body in general is more than for sex and for that type of thing. So I think that's really important, that it shows how does this cycle connect to the reproductive system and that type of thing. So more along that line and why this cycle has to happen. One of the questions that came in, Antoinette, is, sometimes people would refer to the menstrual cycle about Mother Nature. They'll call it the curse. They'll call it many things. And what are your thoughts about, you referring to the menstrual cycle with names other than that is the menstrual cycle? What are your thoughts about that?
I get it.
Mhm.
I completely get it, because so many women have had or are having really bad experiences with their cycle, right? But like with anything else, I think you should call it what it is. Um, it's your period.
Yes.
It's your period. Menstrual cycle, if that sounds less gruesome. I don't know which one is better than others for people. Um, and not because it's bad to have nicknames for stuff like that. It's just that you want people to always be comfortable calling things what they are.
Mhm.
Right? So when I had the conversation about nicknames for the vagina, vagina has such a dirty connotation to it, but that's what it is, you know? And so it's okay if you and your girlfriends want to talk like that, but at the end of the day, this is your body and you have to own it. God made you exactly the way he wanted you to be made. And so this is what it's called. Be comfortable with using those words. There's nothing dirty about it. So that's my approach with the term. But I don't think there's anything wrong with it if that's what you use with your girlfriends. However, the only reason why I do have somewhat of an issue with it is because your cycle doesn't have to be that.
Yes.
There are reasons why Some women struggle more than others when it comes to their cycle. And so, not to minimize their experience, but it doesn't have to be bad, and it's not bad for everybody. So I don't like it for that. I don't call mine that because I actually don't have an issue with my cycle. I call it my cycle. Yeah. See, I just said my cycle. So
And I think that's why we're having
yeah.
this conversation, because I think we want to educate women and just remind us of that our bodies are fearfully and wonderfully made by God, and that they have a name,
Yeah.
and He gave them a name, and they have a function. And so
Right.
I do know sometimes people say Mother Nature because they're maybe being a public setting or period or cycle, but whatever I think they call it. But I think words like the curse would not be something that I would say which should be used at all, simply because the body, there's nothing that God has made is a curse. You know what I'm saying?
Absolutely.
Our bodies.
Hmm.
And so we want to teach ourselves, the young ladies, to respect their bodies. And many times, like you said, everyone's going to have a different experience with their period.
Yeah.
And we're going to talk more about it, but how can you control how you feel when you're having a period?
Hmm.
We have control of how we're going to feel. And many people may call it a curse because of the cramps or the flow or different things, but we want to just be really clear that we want to use the correct terminology as often as
Yes.
possible to not confuse others or young girls who are maybe beginning the journey of a menstrual cycle.
Correct.
But one of the questions that came in, Antoinette, talks about using tampons. There's a mother who's concerned about her 13-year-old who wants to use tampons. She's a little had some reservations about that. She's
Hmm.
concerned that it may affect her health going forward, so, and cause her problems. I don't know what your thoughts are regarding that.
So, that's interesting because usually that approach with using tampons at 13 isn't really about health. So, that's really interesting to see that spin on it. Usually it's from, and actually I can tell you a story, what I thought. I remember in high school, I had a girlfriend whose mother thought that if you used tampons, that you were no longer a virgin.
Okay.
So hearing it from the health perspective is really interesting. But I really like that. Um, I'll say this. If a young lady is not taught how to use a tampon to use it correctly, it can be unhealthy.
Mhm.
So one, you would want her to use a cleaner product. So one that doesn't have a lot of chemicals and toxins in it, like most traditional tampons and pads are. So you would want something made out of organic cotton. That's the best. But also you want to teach her when and how to change properly, right? That she should wash her hands before she removes her tampon, because whatever's on your hands, you're going in, you've now exposed, yourself to whatever's on your hands if you haven't washed your hands. Most people just think about washing your hands after you've used the bathroom, right? But to wash your hands before. Um, and if you as the parent are familiar with how to use tampons, then it will be easier for your daughter to make sure that for your daughter to feel safe using them. And I'll tell you why. When I first tried to use a tampon, I thought it was so painful. I was like, I don't know how people do this. Why are these things so popular? I don't get it. But I wasn't using it correctly. I just did not know. And so if she's sitting there in pain or in discomfort, because it's not really painful, it's uncomfortable, that can cause irritation. So in that regard, yes, it can be unhealthy for those reasons. But generally speaking, no, if you use cleaner brands, some that you can find, Target has a whole section now with clean brands. You can go to Whole Foods, teach her, when to take it out as far as, 3-4 hours, switch out. So she's constantly, she's not sitting in anything, and wash her hands before she should be fine.
Right. I'm glad you mentioned the cotton products that are out there now, because I've seen them even in Walgreens. Many stores are carrying them now, giving that option, to use the cotton versus those other ones that traditionally have been on the shelves. So now there's
Mm-hmm.
a market out there that people are
Yeah.
realizing that, we have a choice. We have options of what we can use. And I'm glad you mentioned, talking about how to use it, when to change it, because I think sometimes when we do anything improperly, it's going to affect the body. Um,
Correct.
So whether it is a tampon or a pad or whatever that is,
Mm-hmm.
the importance of washing hands before and after is a critical to health and well-being overall. I think that's really
Yes.
important. So I know when young ladies start out their period, many times they have irregularities. Sometimes they miss their period. It's not always consistent. This mother wants to
Mm-hmm.
know whether or not they should be concerned when the daughter misses a period.
Um, there's room for concern, but the number one thing, and I know this is difficult. I know this is difficult for personal experience, but finding a great gynecologist will save your life,
Okay.
like literally. Um, and what I notice is that in the beginning, we think it's really, uh, it's it's probably unhealthy, something's going on with her, but think about it. Her hormones are now starting to disperse, right? That's never happened. This is like a new environment.
Yeah.
They've never seen like, oh, these ovaries, oh, this pituitary gland, like, oh, like this is just, it's new, right? So it hasn't really figured out what it's supposed to do yet. So in the beginning, as it's getting acclimated to its new home, it's probably not going to be consistent. It's not going to be regular. So there's room for concern for that, because most of the times if it's an irregular, there's something going on. But usually when they're starting, it's really because it's like, this is new. Okay, these are the hormones. What do we do? Where do we go? How does this work? And so I would just give it time, be patient. But one of the reasons why I said having a great gynecologist is great, because they can talk to you about that. Usually what I see, it happened to me. The first thing they want to do is put them on birth control to regulate the period. That's another conversation. Um, this is a personal statement that I'm about to make. I'm
Okay.
completely against that. I believe birth control should be about controlling pregnancy.
Yes.
Um, and so I'm not sure if there's going to be other questions that dive into that, but you want to figure, she has about 6, 7 months of her period and is starting to stable out, then look at what's going on, like what is going on here, and then proceed to course correct, but give it time to kind of settle in.
So you mentioned, finding a really good gynecologist. At what age should a mother take their daughter to a gynecologist?
When she starts her cycle.
When she start, okay.
When she starts her cycle, because now you're introducing her to her new body,
Yes.
right? She probably, whether she's full chest or not, or completely covered in hair, whatever the case may be, it's new. She went from maybe wearing a training bra, not wearing anything at all, to
Right.
now maybe having a conversation of not wanting hair there. She's in a completely new body. So she needs someone to help her navigate through this new stage of life. So I would say when she starts her cycle.
Okay. Now,
Mhm.
I know that there are female and male gynecologists. So,
Mhm.
any thoughts about where you should start that, what gender, does it really matter? What are your thoughts regarding that?
I say go with whomever you're comfortable with, but I know most women are more comfortable, especially with their daughters,
Mm.
with a female gynecologist. But to be honest, there's a lot of really great male gynecologists out there. So I would say that's a personal decision. I don't think you can go wrong as long as they're good and you're comfortable.
Okay, great,
Yeah.
great, great. So how will you prepare your daughter for going to a gynecologist? Because again, they're going to probably want to do an exam,
Mhm.
and all of that. So what are some of the, let's say, the top 3 things you would want to tell your daughter to prepare for the examination?
One, ask her if she has any questions
Mhm.
before she gets there, and to write them out. Let her know if at any point throughout the process she's uncomfortable, to state so. And, they have to respect that. That's a boundary. And, you could possibly even show her a video,
Okay.
because she may not understand, like, when they bring out a speculum, like, okay, so that goes where?
Right.
I'm going to be touched, because at that point she's going to have her first breast exam, things like that. They're going to collect uh,
The pap smear, the swabs.
Yeah, 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 all of that. Yeah, you knew what I meant.
Yeah.
And so if you're not familiar with what's about to come to happen, you might be a little uncomfortable because you can't see,
No.
right? They're in front of you, your legs are up, you can't see what they're doing. So she may or may not be comfortable with that, but give her the option to show her that, but also let her know that her boundaries should be respected. You'll be there with her because usually at that age they have the parents are allowed, or there's definitely a nurse in there, right? They always have someone else in there with them, but also to have a list of questions, even if it seems silly to her or to you. This is the time that you want her to get familiar with the person who is basically in her most private space.
Yes.
It might be once a year, but you're sharing,
Hmm.
and I put that in quotations, your most precious space with someone else. And that first time they're a stranger to you.
Exactly.
So you have a list of all the questions that are important to you, but now you're building a relationship with that person. Because it might be that your daughter doesn't feel comfortable talking to you, but she might feel comfortable talking to her physician.
Right.
And that's very important because a lot of women are not comfortable with talking to their physician. And they're looking at the most private spaces, right? They're not comfortable asking those questions. So it helping her create that connection with them by listing out things that are important to her concerns, I think is really important.
Awesome. Now you mentioned that about birth control pills, especially when there's irregularity with the periods. And now, are there natural ways that can be used to, correct or help to alleviate the irregularity other than birth control pills?
I think there's a couple of things, right? Diet is super, 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 super. Did I say super? Super important. I don't think people realize how important your lifestyle is when it comes to your cycle. It is extremely important. I don't like to tell people what they should and shouldn't eat. I just like to give them the information, do whatever you will with it. But I'll tell you this, dairy is one of the biggest culprits when it comes to irregular cycles, heavy bleeding, heavy cramping. Dairy is like no bueno. Um, it's not. This doesn't necessarily go for everyone. I can tell you from personal experience that helped me. Um, no meat, right? So processed foods, oh gosh, why? Because processed foods have a lot of chemicals, pesticides, things in them. And that actually is part of the reason why you have so many adverse reactions inside the body. So you don't see it. You don't necessarily know which chemical, which pesticide is actually disrupting the environment inside, but they actually alter your hormones a lot. Um, and then on top of that, so where I was going to go initially with the irregular periods, I think there was a previous question is get a hormone panel done.
Hmm.
I don't know why a lot of physicians don't do this more often. Like they wait till something is super drastic, or they just automatically put you on birth control. I do not like that because it doesn't fix the problem, right? It's not. Birth control is a band-aid because once you're off birth control, it's going right back to where it is. So that lets you know, or where it was before. So that lets you know that I just put a band-aid over something. I didn't fix it.
Yes.
And you want it to be fixed, right? So let's find out why, which one of these hormones are not doing its job, which one of these hormones are being affected, and then we devise a plan around that, as opposed to, okay, birth control, let's just get it done and we'll be fine. You're not fine. You're not. That is my only reason why I'm not a birth control person outside of preventing pregnancy.
Well, I think that you make it really clear that we need to ask the right questions or even think of what are our other options. Because
Mhm.
sometimes when a physician suggests birth control pills or suggest a treatment, we want the problem to go away. And that's our
Right.
want to go away. But what we need to ask questions is, if I do this, will it go away, or will it just alleviate it or lessen it for the moment and I still have the problem?
Right.
And then I think being really educated to say and ask questions about your hormones. Can we do lab work to find out what's going on in my body? It could be,
Mhm.
your estrogen, it could be your thyroid, it could be any hormone that's triggering all of these symptoms that you're having. But unless you know what to ask, you
Yeah.
may be on that journey of a miserable menstrual cycle for longer than you really want to be on.
Yeah.
And I really do appreciate you bringing up about diet. I think we underestimate what we put in our body, how it affects the body. And
Mhm.
so, fresh fruits and vegetables and staying away from dairy. I remember years ago, I was having some inflammation problems in my hands and in all my joints. And I remember I went to the rheumatologist. They sent me to all these doctors and stuff. He gave me 3 medicines. He said, you will need to take them for the rest of your life. I was driving home. I said, there's nothing that I want to take for the rest of my life. This is the honest truth. And I just prayed to God. I said, God, what do you want me to do? And he clearly told me, as I'm speaking to you, I know exactly where I was. He said, take dairy out of your diet. I did it. And I'm telling you, the inflammation went away.
Mhm.
It went away. And so I didn't have to take those pills to try to correct something that a diet was able to correct. So that drug was not going to correct the problem. It was going to band-aid it throughout the remainder of my life. And that story that I'm telling you was over 20 years ago. Had I
Mm.
taken it, all drugs have side effects. So it would have had some side effect along the way, but God was clear to me and said, just take the dairy out. And I've done that. And that was the solution. So I think the reason I tell the story is for our audience, that when we do research on our bodies and learn what helps it and what harms it, then we can make more, educated choices and decisions about what we really, really want to do for the body.
Absolutely. And I think it's also really important. Um, I think I've said this on something else that we've done is always remember that your doctors learned medicine,
Yes.
right? They didn't necessarily learn health. They may have had a module on health. They definitely had a module on diet, but they're not nutritionists.
Yes.
They are going to tell you what they learned, and that's medicine. So they're going to prescribe, and there is definitely room for that. So I don't want to be misunderstood or misquoted.
Sure.
Um, there's space for that, but it doesn't require everything doesn't require medicine,
Yes.
right? Your doctor is great for directive and to help guide you on your journey. And there's some physicians that encompass all of that. They are really into holistic care. So it's nutrition and notice I didn't say diet, I said nutrition, right? They understand health from a holistic point of view, for I mean how everything interacts with one another. And those physicians are really, really awesome. It's really hard to find them. But just remember that the approach is very different from a doctor to someone who works in health.
Yes.
Well, they work in health too, but um, an allied profession that believes in holistic medicine, right? So your cardiologist is not necessary. They should, a really good one will, but they're not they may not think in a holistic perspective because they are a cardiologist. They're thinking about the heart, right? Same thing with your nephrologist. They're thinking about the kidney. And if they're not working integratively with your other physicians, they're only thinking about what they're doing. And
Yes.
then this one thing about what they're doing. But what about what they're doing? How does it work together? Is it synergistic? Like, does it make sense for you holistically? So I just wanted to put that out there because I know, like with my grandmother, if her doctor said it was so, it was so. And, my mom is a nurse practitioner and she works in geriatrics. So she'd be like, Mom, I have a different of opinion, but nope, that's what her doctor said. And that's what it was. And so, just to be open-minded to the possibility that your doctor may not necessarily give you the best directive for you, but that's why it's really important to just find really great physicians that you feel work for you.
And
Sorry, that was a tangent, but I just had to say it.
no, I hear you. I felt like I went off, but I think what that brings to my mind is, as females are talking to their daughters or granddaughters or nieces or nephews, or not nephews, but nieces, talking to them about their menstrual cycle, that they need to make them aware that they may go through different periods of that cycle. So it may regulate after 6 months, but then they're going to become teenagers and young adults. And sometimes it's regulated for a long time. And then maybe when they get in their 30s, it may start becoming irregular again, or different things will happen in life.
Yeah.
I think what's important is that the conversation is had about when you do have those painful periods, uncomfortable, heavy cycle, what are your options? Who can you get advice from? Meaning you can go to your physician, but are there other, can I get a second opinion from someone who believes in that holistic health? So I
Yeah.
think that, at the time when you have the first conversation, that may not be the time to give them all of that information. But I think
Right.
if you transition, maybe go to college or in high school, that conversation changes a little bit, because again, they may have different encounters or different experiences with their menstrual cycle. And I think that's when we run into problems, because many people go for years and years and years suffering with that problem and not getting the attention that they need or the help and treatment
Mhm.
they need. And they're frustrated, they become depressed, all kinds of stuff happen as a result. And then the body, you know, is under attack, and it could
Yeah.
affect them later. So
Mhm.
I think that's important to have those conversations, not only about your gynecologist, but who else has information that I need to know, and refer that. So one of the questions that I have is, how should a mother try to support her daughter if she's having those severe cramps? And what are some natural things they can do to maybe help alleviate it? We've talked about dairy, but what other things can they maybe do to help support during those cycles?
Um, are we're still talking like young as they're starting out?
Yes.
Um, One of those things, definitely with the cleaner products. And the reason why I say that is because there are studies that show that cleaner products reduce the amount of bleeding and cramping.
Okay.
So, making sure they're offering them better options from the beginning. That's number one. Number two, I would say probably being, how do I say this? Being open-minded, because from my personal experience, I've had friends whose parents, kind of going back to what I just said, believe that this is just the way it is for us, right? So they're like, just go get a hot pad, and I mean like a castor oil pack or a heating pad, take two leaves and you'll be fine, as opposed to listening to what your daughter is saying, right? Because you're finding that girls as young as like 18, 19 are finding out that they have PCOS or endometriosis. And so you're thinking that she's being dramatic, and you're like, oh, all of us go through all of this. Like it's just what happens to women. But listening to her, and I don't want to say it's necessarily supporting her, but if it means helping her find another physician, if it means going with her to her physician, if it means doing some research to find out, like, oh, I hear that there's a lot of women going through all of this, maybe we should ask the doctor about that. Because unfortunately, a lot of women who look like us, we go undiagnosed a lot, because one, research shows that we're not believed even by our physicians, right? So we struggle and deal with a lot of difficulties during our cycle, even through pregnancy, post pregnancy, because we're thought to believe in the medical world that we can manage a lot of pain. So if we say that we're in severe pain on a scale of 1 to 10, if we say it's a 10, to them it's a 5.
Okay.
Right? So being an advocate for her, I would say, is being the best way to support her. Listen to her. Not everybody has, you've never experienced an endometriosis period until you've had endometriosis. I never had endometriosis, but I've seen my aunts, I've seen a friend struggle really, really bad. So one, getting her, of course, like I said, clean products, because it does help, but also being an advocate for her, being a voice for her, because she may not be, she's under 18. So you have to be her voice. I would definitely say that. Do not minimize her pain.
Sure. And I think that emotional support that you're talking about that you provide to her is going to make a difference of whether or not she comes back when there's other problems. Because I think you
Yes.
want to keep that door open and that conversation open. Because if we appear that we don't believe them either, or, just maybe put a little Band-Aid on it, drink a little more water, which water does help, and put this pad on, this heating pad on. If we don't listen to them when they begin to really have maybe more severe female issues, they may or may not, confide in us in that conversation.
Right.
And what I have found is when you confide in a friend, they don't know any more than you know. They're just a friend. They're not, they're the same age as you are with with this, with a limited experience. So
Yeah. No, that's so true.
yeah,
Yeah.
I think we want to make sure that we leave an open door open by supporting them and not comparing them to you. Like, well, when I was that age, I didn't have those problems. Well, in truth, maybe not. But again,
Mhm.
there's so many other factors I think that we have to take in consideration that when we were growing up, it's a whole new world that we're dealing with now. The stress,
Absolutely.
even stress can cause the body just to clamp up and be tight. And there's so many, just sometimes emotionally, the body is just tight. And so the body's pain comes as a result of
Mhm.
that, you know.
Yep, absolutely. Yeah.
One of the other questions that I have is, and I think I have two more questions that we want to answer, but one was about whether or not, what are the signs and symptoms that my daughter may be inappropriately touched by a male or a female? What are some of the signs
Okay.
and symptoms that maybe a parent, whether it's a mother or a father, should pay attention to? Um, there should be a clue or cue that to them that something's not quite right.
I'm glad you said male and female because I think sometimes we automatically think that it's a male predator, and there are a lot of female predators out there. So I'm glad you said that. I think there's two things depending on the age,
Mhm.
right? Well, one of them shows up no matter what age. One only shows up depending on the age. And if you're still bathing your child, one, obviously there might be redness, but usually as a mother, if you're bathing your child still, you're still cleaning her private parts. How does she respond? Does she clam up? Does she, shiver? Is there fear in her eye? Like there's very visible signs outside of, the fact that you can't open her up and look, right? So pay attention to your children. They will show you exactly if they're going through something. Now, when they're older, it's a little different because your interaction with them changes. But one thing we know, it doesn't matter whether someone's being touched, whether feelings were hurt, children shut down. But you have to also know your child. So we're not talking about my child is really shy and quiet in their room. We're talking about a child who is shut down emotionally, a child that um, doesn't respond to you in the same way. And I know that can be tricky, especially when they become teenagers. God knows, I have a 17-year-old, and he went from wanting to cuddle all the time to being locked up in his room. So I understand that part can be tricky, but his personality didn't change, right? He was moody, he was mopey, he was locked up in his room. But his personality didn't change. I didn't see a different person,
Okay.
right? So I would say one of the biggest things is to create a relationship with your children very early so that you're able to read them, you know? I think that's more important than anything because you can ask them whatever and they can lie.
That's right.
But if you know your child, mm-mm,
Yeah.
there's certain things that just cannot be hidden from you. Like you just like, no, something is not right. But you have to create that space also that they feel comfortable. I don't care if Mr. or Mrs. So and so said they're gonna blow up mommy and daddy's house.
Right.
You're willing to risk mommy and daddy's house being blown up. Create that space for them. Um, yeah.
And I think you bring up a very good point. When you know someone and you see a change in behavior or a change in just who they are, the core of
And,
who,
and patterns, changing patterns,
oh, pattern.
right?
Okay.
Yeah. Hmm.
So I think that's important. If we see any changes like that, that we begin to ask those questions and pay attention. Even pay attention to the people who are surrounding them. Who are they
Hmm.
around? What are they looking at on their phone? What has changed their interest? What are they now more interested in than maybe before? And granted, it will change as they become, teenagers and young adults and things like that. But it certainly should be, we should be aware that the world that we live in today is
Hmm.
not the world we lived in before, and it was happening then. But we do know there's human trafficking, and we know that it is important that we are mindful and aware. Maybe if they're changing the way they dress, even I think that's one of the things that may be a clue that now they're trying to dress a certain way to either cover and hide themselves, you know, because they're
Hmm.
shaping their bodies, or maybe they're being shown more revealing clothes when they're like that's not who they normally are. So I think that's the
Right.
cues and clues that we need to begin to look at as it relates to how to care for the body.
Absolutely.
So, the last question we've actually already answered, and it talked about what causes the painful menstrual cycle. And we talked about sometimes the foods we eat, stress we're under, maybe lack of exercise, even not keeping the blood flowing in the body like we should.
Hmm.
Anything else that you can think of that would, cause a debilitating, painful periods? I mean, endometriosis, you mentioned that. Um,
Right. Something could be as simple as an infection, right? Infections can be from so many different sources. It doesn't necessarily just have to be a vaginal infection. It can be chronic illnesses outside of the reproductive system that can cause really irregular, painful cycles. If you're from being diabetic to having heart issues, a whole slew of things. Stress,
mm,
like you said, is definitely one of the top. And sadly, children younger and younger are under a great deal of stress. And so I wouldn't rule that out, especially children who might be really active. So after they leave school, they're going from one activity to the next activity. On the weekends, they're involved in this. They're like, that can be stressful as well. So it doesn't necessarily have to be, how we perceive stress to be. That's stressful for them, right? Um, Definitely diet. It could, and hormones.
yes.
Hormones, that's just one thing that is really important to just have it checked and know what's going on with your body. But I would and then sometimes it's just as simple as pregnancy. You can still have spotting, or that you might think is irregular spotting, right?
Mhm.
And be pregnant.
Yeah.
um some parents may not want that, but that's the reality of it. That can be hidden for a while. I mean, I have my son in my 20s, but I didn't start wearing maternity clothes till my baby shower.
Wow.
So I carried very small,
Mhm.
you know, not that, but I was never a skinny girl, right? I've always been a solid person. So of course my stomach grew, but it wasn't like this huge belly. It literally happened overnight. It was like, oh, there's the baby, right? I was wearing literally my own clothes. So that is something that can be hidden,
Yes.
whether intentional or unintentional. But yeah, think about different infections, pregnancy, chronic illnesses, stress, diet, imbalanced hormones. There's so many reasons.
You bring up a really good point, and we'll probably need to have that conversation out at another time. But even pregnancy, I mean, I have friends who got pregnant at 13, and
Mm.
so I think that parents need to be aware that
Mhm.
once their daughter begins to have a menstrual cycle, she's at high risk.
So that's another reason why parents are afraid. Like, this is like she's now a woman,
Yeah,
right?
yeah,
And a woman is in the sense that she can reproduce,
that's right, right,
Yeah.
right. So we'll have to have that conversation, but I do know that that is probably sometimes the reason that there's hesitancy to have
Hmm.
a patient, because it's like, oh my, I'm afraid for her because now
Yeah.
she's in a space, that possibly she could become a mother at a young age. So I think the conversation has to be had. I mean, I want to thank you, Antoinette, for having this discussion with me today. There's a lot of questions out there about the wonders of women's health. Many people just don't know the answers. I mean, I'm a healthcare professional, and what I do know is this conversation just doesn't even happen in the healthcare arena, even,
Hmm.
people will come in. I remember when I worked in surgery, we had one lady, she had come in and she was getting ready to have surgery, but they always do a pregnancy test ahead of time. only to find out that she was pregnant. She didn't even know she was pregnant. And so we couldn't do the surgery on the general now because she's pregnant,
Right,
with
right.
local anesthesia. But I think the reason we want to have these conversations is for our audience to know that it's okay, number one, to be a woman. We can be
Hmm.
proud of our bodies. We
Absolutely.
can be knowledgeable about how the body works, you know. And many times we just think about the menstrual cycle, but the way we think sometimes affects our body. It does affect our body. We know it affects
Mhm.
our body.
Yeah.
But we want to educate our next generation of ladies, our current generation of ladies, about the importance of knowing your body inside and out. It's not enough to put on pretty clothes and look really nice. It's
Hmm.
just as important to know what's happening inside of my body that is going to affect my entire body. Like you said, there could be chronic diseases that are going on, infections that can be going on, but we want to prevent any disease that we can possible from happening within the body. And the way we do that is by educating from early on, puberty all the way up through adulthood, staying knowledgeable,
Hmm.
staying connected, choosing a great physician, using resources, whether it's videos or books, whatever that is, that we can use those to educate ourselves and educate the next generation on how to care for their body to prevent some of the endometriosis, how to prevent those pelvic, conditions that we have, how to prevent sometimes infertility. So it's
Hmm.
important to have those open conversations so that people will know there's nothing shameful about what God has made in our bodies. Any final thoughts, Antoinette?
Oh, we touched on so much, and I think you really summed it up really well. I think I just want to echo, start becoming comfortable with the conversation. you know we definitely don't want the next generation to have the same experiences. The hope is that things progress and get better. Just like we talk with other topics like racism, we're hoping when that conversation happens that things progress and we live more a more unified in a more unified space. And so think about it in the same way, having a conversation so we progress and women are more empowered with who they are, and that's because we started forging the path for them and with them. So yeah.
One thing that I want to end with, you brought forward about, sometimes when we go to the doctors, we don't get the same attention or the support from them because they don't believe us. And so I would want to leave with this for our audiences, because now we know that it's important that we are an advocate for ourselves. And if we need to take someone with us to be an advocate with us, because it's important that we do not allow our voice not to be heard in a space where we should be getting the health care that we need. Because any prolonged condition, I've learned this, personally and through working in healthcare, the longer it prolongs, the more at risk you are of it not being able to be reversed.
Hmm.
So again, if the voice is not being heard, it may require you to choose another physician so that you can get the attention that you need so that you can live the healthiest that you can live.
Excuse me. I'm glad you said that, and I know we're wrapping up, but I want to echo that, and I want to stress that because we have the highest rate of postpartum deaths
Yes.
than any other set of women, higher than Latina women, Native American, and especially white women. We are not listened to. If in your gut you feel like something is not right or something is wrong, you have to be your own advocate. Serena Williams, I think she's probably the biggest figure that has spoken out about this, but she almost died because she was ignored, and she refused to be ignored after she had her baby. Um, so it's past the menstrual cycle, but the point is, women, specifically Black women, are not listened to. Doesn't matter how much money you have. We're talking about Serena Williams, the number one tennis player in the world, was not listened to and almost died after having her baby. So it's extremely important to be in tune with yourself, in tune with your body, trust your gut. I say that the gut is the Holy Spirit, like, period. There's nothing around it. And even if you're wrong, you're wrong. But you don't know that you're wrong
That's right.
until, you either don't wake up or you wake up out of well, at that point you don't know, but out of surgery, whatever the case may be. The point is, you said it, you have to be your own advocate, listen to yourself, and have people around you, kind of like what I was talking about earlier with the young girls, parents being their advocate. You want people around you who support and will advocate for you as well. So
But,
completely agree with you.
it just seemed like, as you say one thing, I think of another thing. So I I do know that I'm part of Central Florida Black Nurses Association, and we were at Capitol Hill last week, and that is one of our agenda items about postpartum deaths for Black American, African American women. And so that's
Mhm.
on our agenda for this
Yeah.
year to see how we can get legislature to look at the education, look at how we can improve that. So it is a big deal. And I mean, in my mind, as you were speaking, the key word and the key takeaway for our audience is listen to me. Listen to me. If I say that I am hurting, listen to me. If I say my cycle is painful, listen to me. And then at least when you listen, then you're more likely to respond. And so, the takeaway is listen to your daughters when they say they don't feel well, when they, whenever you begin that conversation with them, listen to them if they feel like they're embarrassed about it. I think what we minimize and don't really understand is how we educate our daughters when they become wives will determine how they include their husbands in their conversation, you know what I'm saying, about their bodies as well. Meaning that husbands should know about their wives' menstrual cycles. They should be well
Absolutely.
informed. They should be
Yep.
well informed, and fathers should support the mother in knowing about their daughter's cycles as well. Because sometimes mothers may not notice something that a father would notice if he knows what should be happening at that time in her life. So I think that,
Mhm.
there's so many things that surround this topic. That's why we will have other conversations about the wonders of women's health. We're wonderfully made. God said that. And so we want to make sure that we take the very best care that we can of our bodies. Thank you for joining us. We're so
Jennifer, you
yeah,
just made me think of two more things.
go ahead, please. Please go ahead. I want to hear it.
No, we got her, but there's only two more things. So, speaking on the men in our lives, that's extremely important. Like I said, I have a 17-year-old son, and these are conversations I have with him because he is going to be someone's husband, he's going to be someone's father, and he is going to be that support in the home. Now, granted, because it's not his experience, he can't speak to it from that perspective, but he can also be her advocate, and he can also be a support. So definitely, if I talk to my son, I think it's important to have conversations like this with young boys as well. Not the same conversation because it's different. It's not their experience, but give them an understanding of what it really is. That
Great.
was the first thing. And then the second thing is another reason why it's really important to listen to yourself and to listen to your daughters, your friends, whomever. I was watching a group discussion by Black physicians. And
Mhm.
I think I may have shared this before. And they were talking about how one of the reasons it's really difficult for Black patients to be heard, or their feelings, their thoughts, their pains to be respected, is when they are in med school, they're usually taught by white professors, books written by white men and women, usually men, but the examples and the things that they see in the book, be it a rash, be it, a lesion, whatever the case may be, is on white skin,
Okay.
right? So how it translates on colored skin, and when I say color, that could be the gamut from, Afro Latina, Black, Native American, everything in between, is very different. So a lot of times doctors don't even know what to do with us because they've never even studied
Yes.
on us. Well, they have studied on us, but I'm just talking about from a textbook point of view.
Yeah.
Uh, Stay focused. So something is wrong, but see, they've never seen it in a book.
That's
They've
right.
seen it. They just never seen it on someone that looks like you.
Yeah.
So it doesn't correlate. It doesn't make sense. They can't always see it.
Yes.
And so they'll just, brush it off as, it's just some, maybe it's just dermatitis. Maybe you just rubbed up on something and now you have this, who knows? So that's even more reason to be an advocate, to be like, nope, I'm not leaving here till I have an answer. We can figure this. You want to biopsy this little thing? Okay, let's biopsy it. You want to go ahead and take something for a second? Let's do that, because a lot of times they don't know. And so one of my very first things is making sure you find a really good physician.
Yes.
We don't necessarily know who's a good physician, but of course referrals are always great. But how do you feel connected to this person.
Hmm.
It's extremely important. And it's not to say that a white physician can't be a great physician, because there are a lot of great white physicians. The point is, sometimes their point of view can be skewed, just like our physicians are skewed because they've never experienced it. They've only learned it from this perspective. So I wanted to say that as well. Listen to yourself and your
Listen,
daughters.
and I agree with you. Listening to yourself is the Holy Spirit speaking to us. I would not have known not to take dairy out of my diet other than the Holy Spirit told me what to do. And he does that.
Mhm.
Even now in my life when I'm not feeling my best, he will tell me, pinpoint automatically what's going on with me. And so I think for our audience, there's several things that we want you to take away. Number one, know your body, learn the anatomy. I mean, it seems complicated, it seems really difficult, but know your body. There's many books out there, easy references. If you don't like to read, there's, things on YouTube that you can just watch so that you will
Mhm.
know where your ovaries are, how they function. You know the purpose of the uterus, how it functions. So you will know how, when the doctor says you have this, you will know exactly what part of the body is actually being affected by it. Because many times
Right.
that. So know your body, listen to your body. That's really important. If you're not feeling well, what's causing that? Make sure you are able to have those conversations, not only with your young ladies, but sometimes older women. We didn't talk about that. We'll bring that up in another discussion. But as we get
Mhm.
older, our bodies change, the hormones change. And so there's times our hormones are really affecting our body at certain times of our lives. And we want to ask the doctor if he hasn't thought about it or she hasn't thought about it. Can I have a hormone panel? Can I have some lab work done to see how my hormones are doing? And then,
Yeah.
because when you talk intelligently, are they going to say no? They could, but again, you just can, continue to pursue it until you get the information you need. The other thing is pay attention to your young ladies and make sure that if there's any changes in their behaviors, the way they are just their mood or anything like that, pay attention to them. And if you're still bathing them, as Antoinette said, pay attention to how they respond when you come into their space. And so that we can be mindful of how to take action. And I think that's the key word with all of this, take action, to make sure that we're protecting our body for its well-being. Look for those hygiene products that are the healthiest for the body. And you can only make that decision, but be educated on why are there two different types of products or five different products? What are the chemicals in those products? And are they affecting my body? Thank you
Mhm.
again. I want to say thank you for joining us. We could go on and on. There will be
We could.
conversations. I absolutely love talking to Antoinette. We just talk like, we just go on and on. But this is important. We are out here because we believe this is important. Social justice is important. The pandemic is important. The vaccine is important. Women's health is equally important because if we are not well, we will not be able to care for our body, care for our families, care for
Mhm.
ourselves. We will not have that healthy and happy life that God desires us to have. Until next time, be well. Bye.
Thank you, Jennifer.
Again, on behalf of Tree of Life Connection, we want to thank you for joining the Wonders of Women's Health today. What every female should know. Antoinette Erskine share some vital information that we need to know about how to care for our bodies from puberty through adulthood so that we can live healthy, happy, and even holy. She talked about the Holy Spirit inside of us, and God has fearfully and wonderfully made us. And so we want to make sure that the way we care for our bodies, mind, body, and spirit, that it honors and it glorifies God. It says, whatever you eat or drink or whatever you do, do all to the glory of God. So again, on behalf of Tree of Life, I want to say thank you for joining us. And until next time, be blessed.